describe and demonstrate the type, articular surfaces, capsules, synovial membrane, relations, movements and muscles involved, blood and nerve supply, and bursa around the hip joint. It is a common, in these headings, you will be studying all joints. It can be a knee joint, it can be a hip joint, it can be a shoulder joint. You just have you put it in your mind that under this headings, you will be describing a joint. So, you have to know the anatomical basis of complication of fractured neck, describe dislocation of hip joint and surgical hip replacement. Now, hip joint, I told you, is a ball and socket type of synovial joint between the head of the femur and the acetabular cavity of the hip bone. Hip joint transfers the weight of the upper part of the body to the neck of the femur and supports the body weight in standing position. It is the largest ball and socket type of joint. Type hip joint is a ball and socket variety of synovial joint. It permits movements in many axes, hence multi-axial joint. I told you regarding its movement, and also the femoral head is round and it is not totally this thing, but it is a part of a hemisphere. The major part that is articulating with the acetabular cavity. Now, the hip joint has following two articular surfaces: proximal articular surface or acetabulum. Acetabulum, lunate shaped in Latin, consists of horseshoe shaped articular surface, acetabular notch and acetabular fossa. Articular or lunate surface is covered by articular hyaline cartilage. The outer margin of the acetabulum provides attachment to the acetabular labrum that increases the depth of the acetabulum. This is not this skeleton's pair. It is a different body, this is a different body. But you have to know that the acetabular labrum is covered like this. And now the head of the femur is globular, smooth and forms more than half a sphere. The articular surface is covered by an articular hyaline cartilage except at the lower capitis, a small pit. Okay. I had shown you in the previous 3 classes, I was discussing the upper end of the knee joint, this in tibia, the fibula. When I described, I also described the femur and also told you the articular surfaces, how it is acting, how it is, the movements are there, and especially in the hip joint, it is, and I compared and showed you in the skeleton that the hip joint is a more secure joint than the shoulder joint, because of its the glenoidal cavity is shallow, so it can go dislocated very easily. Dislocation in hip joint is tough, but it is there if you are going in high speed and head-on collision with the any opposite side car or vehicle or motorbike, anything. You try to save that person, then you just put a brake, then that with the force that can be dislocated. When you are like throwing a ball, and there are some from congenital aspects, there are some weak shoulder joints. So anytime that gets dislocated. Now, hip bone lateral surface. This is the acetabulum. This is the lunate surface, acetabular fossa, acetabular notch. Now, the greater trochanter, intertrochanteric line, and this is the lesser trochanter. This is the head of the femur and the fovea is here. And now you see, this is the transverse acetabular ligament. The lunate surface, acetabular fossa, and transverse acetabular ligament. This is ossified. You see, it is a rarity. This is ossified. The transverse acetabular ligament. This. You please, everyone, take an opportunity to see that the acetabular ligament is ossified. You cannot exactly define how, why, but it has ossified. You compared with this hip bone and you compared with the articulated hip. You just see it and one by one you just transfer to your next person. Now see, you go to Chat GPT or internet that this type of rarity is there or not, or reported or not. It's a very rare happening. Just for your own interest, you just see if it is possible or not. It is possible, that's why you are getting the articulated hip with the transverse ligament being. Now, hip joint type articular surface, ball and socket, synovial joint, acetabulum horseshoe-shaped surface, distal head of the femur covered by articular cartilage, ligaments, see this is important, capsule, Iliofemoral, Pubofemoral, Ischiofemoral, Ligamentum Teres femoris, transverse acetabular and acetabular labrum. Now again, it's a repetition that capsular ligament, iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, ligamentum teres femoris, transverse acetabular ligament and acetabular labrum. Now, see, I told you the comparative. I showed you earlier when I was showing you the shoulder joint that this picture is similarity with your hip joint. You just put in the two pictures side by side. Even I discussed the Perthes disease earlier. Here the Santon's line. Shoemaker's line, hip replacement surgery. Hip replacement surgery or arthroplasty is a surgery for replacement of the worn out, osteotic or damaged hip joint with an artificial joint prosthesis. It may be partial or complete hip replacement. See this, even fractured neck femur, they go for this type of operation. Replacing with titanium ball and your prosthesis. Now, dynamic hip screw, DHS fixation, is an orthopedic implant that is designed for fixation of fractures of neck of femur. See, this is the bone screw. Now, hip bone, please, hip bone, single hip bone. Side determination, when you hold it in anatomical position, then you have to know the side determination. Which side is this bone belong to? Right side or left side? Now you hold, this is the ilium, the ischium pubis, and this is the and now this is the acetabular cavity. This is a socket. This is external. External. Even this can be external. Left hip can, I'm showing you just for this thing. But your main identification is the one of the thing. This is the pubis. It will, you hold it like this. This is the anterior superior iliac spine. This is the iliac crest, the iliac tubercle, and then you go posterior. And this is the rough surface to produce the, with the sacrum, it articulates with the sacrum. This is the ear-shaped, Kandirmukhi. This is the ear-shaped articular surface of the hip bone and the sacrum. You please, when you come for dissection or hall or next day, then you see it in the skeleton. Please correlate with the this lower limb. You please correlate with the skeleton when you study or you revise. Now it will be a revision for you. And now hip pelvis, please. Now this is the left hip bone. Now this is the composite articulated pelvis. Two iliac bones and the sacrum. Now symphysis pubis faces anteriorly. The iliac surface, smooth iliac surface internally. This is smooth iliac surface, this is right iliac surface is internally. Pubis is directed like this. Directed like this. Hold it like this. The sacrum posteriorly. You don't hold it like this. Then again the iliac surface is internally. This is internally. But sacrum won't be anteriorly. Won't be anteriorly. You have the pubis, symphysis pubis anteriorly. I think you will never make a mistake. Because of the anatomy, now you see the sacrum, it cannot be lifted. Now you can see the vertebra, it goes. Now your spinal cord is descending. It goes through the sacral foramina. As the nerves and the coverings, cauda equina at the one level and then goes down. So this is the common plan. Okay. Now you see you hold your own hip like this. Now the muscles are rising to form the anterior abdominal wall and also your lateral part of the abdomen, thorax, medial part, all these muscles. That muscles are rising from the iliac crest. Okay. Now your buttocks, your both pachu. Now you stand like this. You can see, make it taut. You will see that it is tight. Okay. The gluteal muscles, the gluteal maximus, the medius, that is covering the gluteus surface. Then when you give an injection, say there are some oil-based injections, some water-based injections, actually and some painful. Now these injections, I always write deep muscular gluteal, as sometimes the pharmacist or the person serving the medicine. So I write Pachai Deven, Pachu, Bengali. I write Bengali because your ultimate aim is to provide relief to the patient. And if he is given an injection with say so much, 3 ml, it is not 1 ml or 0.5 ml. It's not always. Depending on the type of injections, you put it here, deep, and then you see the anterior leg spine. Put your palm like this and inject here. Then you won't be damaging nerves and vessels. So you put your hand like this, you put the iliac crest in the initial stage. Nowadays you will be just put in. You think of you being injected, how you will feel if it's not properly done. So when you go to your clinics or this thing, when you have an opportunity or an internship or some training in the thing, you please know the injection site. Ota to nurse ra korbe. You cannot categorize. It's a teamwork. Now the sister is in a hurry to put in the tubes and pipes and this thing, connecting machineries to the body which is presented to you in the emergency. Then you take the initiative to take an injection and put it. It can be IV or it can be this thing, or you put up a channel. ডাক্তার বাবু হাত দেবে না, করবে না, গলায় স্ট্যাচুটা থাকবে, অ্যাপ্রনটা স্টুল পায়খানা হাগু, that won't be your stained. It won't be stained with blood. It won't be stained. You do like this. Then don't come to medicine. Why I'm telling you this? This is a modern trend. You will be saying, AIG, ChatGPT, what should I do now? People with diploma certificates and different online courses and webinars and all this, they are A4 size one paper, half is of this type of, I don't know, it's fake or it is good, it is from universities or something like that. London, this thing, Australia, Germany, all this. The pain management doctor is not touching the place where she is complaining of pain. হ্যাঁ বলুন মাসিমা বলুন, investigation, CRP protein, thyroid, vitamin D3, and 4,000 rupees tests before realizing or understanding the pathology of the condition. It's a trend and it is malpractice. Now, if a person comes with an acute pain, and then you lie the patient, see if he's having any bony injury or not, any spasm due to some disease, you have to touch. That's why I showed you this thing. I put up two big pictures, one of Hippocrates and one is of Shushruth. You see their gentleness. Hippocrates is palpating the liver. And you see the mother, she's satisfied. No, my child is in the safe hands. Bhagavan speaks or not? Yes or no? Bhagavan is Jai Sri Ram, Ram temple, Jai Kali. you bang your head on the floor of the temple, Jai Jagannath, or Allah, they won't answer. A human being answers. You are a human being. So when you are seeing the blood pressure or anything, or your assistant says, but when the assistant goes and seeing the pressure, you at least hold the hand like this, see the pulse. You have to develop this technique. Especially, I'm telling you, I'm not deviating because of the pain management. A patient comes out of, like 20 patients has enrolled in your outdoor, in your clinic. Every one complains of pain of different condition. All is not coming with a hip pain or your pelvic pain or backache or something like that. So, the injection site, this is one place. Another place is in the quadriceps. But you have to be careful where you're, okay. Even small children, even 1 day old, or you have delivered by LUCS or local anesthesia, then you have to see the most possible site, and also that would harm the baby or the neonate. Now, you just see, I told you, you take the hip bone like this and you see the muscles coming up, the ligaments. You don't have to imagine, you see in your atlas or your tab or whatever you have, you see, you read a book and you see, you put your khata. Don't try to put a small phone and try to revise and then scroll. GeoNet, Sudarshan Chakra, no net, internet, no Wi-Fi. Don't depend. You're killing time. You just go into your book. And these things, the iliac crest has some muscles that is from internal to outside or external to inside. It's your choice which you can memorize easily. Then the gluteus, there are 3 glutei. Now you see some bones in your personal collection, there are some ridges. So that might be a person always in this thing. From young age, the muscles were hyperactive or active. That brings your lines. It's a small this thing, and that with the development gives a line. But just in the top, it is you compare with your friends, and then you will see the anterior superior iliac spine. It has a ligament, inguinal ligament, and then it goes into the pubic crest. Then it forms a small pectinate ligament, triangular, and then your abdominal muscles are rising from here. You please see the dead body. Dead bodies are there, opened. You please compare. We can follow, then you don't. তাই জন্য আমি তালা মারবো ঠিক করেছি। তোমরা ঢুকে যাবে, আমিও ঢুকবো। আর বলবো না, কারণ তোমাদের পরীক্ষা আসছে। ইউ গট ইউর ডেটস কবে? হ্যাঁ, কবে থেকে?
10 to 12.
3 days না 4 days? 3 days. ঠিক আছে। Now, তোমাদের I'm telling you, sometimes I'm speaking in Bengali. That is but you can still try to understand. Then if you are not understanding, please raise your hand. This I told you. And you are a late comer. Now, those I told you earlier that you have to your anyone miss the histology or something like that, you please, I told you, তো কালকে তোমার physiology না biochemistry? Physiology. So next week you make it a point. Make it a point. You come. Those who previous day you tell Avinash, be in a group 4 of 10 people. You tell him that these slides we want to see. Then he will give it to you. He will arrange say 5 slides. Next week you take another 5 slides. Then you see it. But this 1.5 hours, I'm telling you. So half an hour goes for latecomers in histology, and 1.5 hours you still have. The 1 hour you will be having, you go for osteology or whatever, your OSPI or something like that. You try to, this thing, you do your part of the revision in the hall. Please don't go, don't leave this place. Don't, because I'm telling you, we are getting things there. তুমি দেখবে গল্প করতে করতে পিঠে ওই ব্যাগের চুল টানছে, নাহলে এটা চুল টানছে, এই করতে করতে তুমি লাঞ্চে যাচ্ছ, তারপরে গিয়ে খেয়ে একটু ভাত ঘুম, এটা হতেই থাকছে। তুমি টেকিং মেডিসিন, any yogic practice you are doing for your running nose, a nasal drop, a small Calpol tablet. It's you might feel comfortable, I'm saying. But if you say, no, I want to increase my immunity, I have the immunity, they go on. And please, I just cannot resist myself advising you, but requesting you, I would say I am requesting you.